Breast implant infection is one of the most feared complications anytime we place a breast implant. Signs and symptoms of acute infections include, but are not limited to, redness, fevers and chills, breast pain, and drainage. Symptoms occur on average around 10 days after the procedure, and literature rates for this range from 1 to 2.5% in cosmetic augmentations, and much higher in breast reconstruction patients. There's also something rare called subacute infection, which can present later with reports occurring more than 50 days after surgery. Symptoms can include chronic pain, persistent drainage, and failed healing of the incision site. It's also important to know that not all postoperative redness is infection. This can be allergic reactions to tape, glue, reactions to the bra, cellulitis, which is an infection of the skin, or many other causes. This is why it's important to let us know if you see any redness, swelling of the breast, you have fevers, chills, or concerns of breast implant infection, please call. If you have signs of infection that are spreading rapidly, over hours with significant change, this can be a very rare condition known as necrotizing fasciitis, which is a rapidly progressing infection. This is a surgical emergency and you must notify us, seek emergency care. Finally, there are reports of late infection months to years later following other unrelated procedures, such as those that break mucosa like dental work or skin like piercing. Consider prophylactic antibiotics when having these procedures completed. So how do we prevent implant infection, and how have we maintained such a low infection rate? By utilizing the principles from the 14-point method. Not all of these steps can be utilized for every patient. However, some of the steps include IV antibiotics and antibiotic washes, optimizing the approach, cautious proactive surgical technique, limiting contact with the implant, and meticulous closure, among others. So we're concerned you have an implant infection. What do we do next? Well, to evaluate, we will do lab work, cultures, ultrasound, or we'll just proceed to the operating room. If we determine you have an implant infection, this often requires removing the implant for a period of 3 months and then replacing it. Breast implant infection rates have been estimated around 1% and is very rare, but an emotional event. However, with prompt identification and treatment, has a very good long-term prognosis.